Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Guys, we're continuing our review of the official ICD-10-CM coding guidelines. We're going to continue where we stopped on last week, and we were down to we're in section 5, diagnostic coding and reporting guidelines for outpatient services, and we are down to G. And G is on the ICD-10-CM code for diagnoses, condition, problem, or other reason for encounter or visit. Now remember, we're on an outpatient basis. On an outpatient basis, we consider the doctor office visit as an encounter or a visit. So let's go to the guidelines and see what it says at G. List first the ICD-10-CM code for the diagnoses, condition, problem, or other reason for encounter or visit shown in the medical record to be chiefly responsible for the services provided. So notice it's telling you what to list first. A lot of students email me, they're not sure of the order to put their codes in. But here it's letting you know, list first the code for the diagnoses, the condition, the problem, or other reason shown in the medical record to be chiefly responsible for the services provided. Then list additional codes that describe any coexisting conditions. And in some cases, the first listed diagnoses may be a symptom when a diagnosis has not been established or confirmed by the provider. Okay, let's see what my handout says. Notice the order to list your codes. First, identify the diagnoses, the condition or problem, or the reason for the visit, and then any coexisting or chronic conditions. This order is important because reimbursement is determined by the first listed code. All right, then we go to H. Uncertain diagnoses refer to the guidelines. H says, do not code diagnoses documented as probable, suspected, questionable, rule out, compatible with, consistent with, or working diagnoses or other similar terms indicating uncertainty. Now remember, this is different from the inpatient. Rather, code the condition or conditions to the highest degree of certainty for that encounter or visit, such as symptoms, signs, abnormal test results, or other reasons for the visit. And remember, I clearly stated in the inpatient that, again, this differs because the after study in a hospital should lead to a definitive diagnosis. However, if it doesn't, physicians tend to have a working diagnosis in mind, that it might be probable or suspected or questionable or any of these uncertain type diagnoses, but that's what the physician thinks it is, so that's what the physician is leaning toward, and that's what he's treating. So my note just says, pay close attention to this guideline. Notice, for inpatient visits, you can code uncertain diagnoses. However, for outpatient visit codes, the sign or symptom instead of the uncertain diagnoses is coded. All right, we're down to I, chronic diseases. Let's see what I says. Chronic diseases treated on an ongoing basis may be coded and reported as many times as the patient receives treatment and care for the conditions. So let's see what my handout says. Remember, my purple notes are Codemaster Coach notes. I state that because just in case someone is just starting at this video. The chronic condition must be treated or have a bearing on the visit to be coded. When teaching, I like to tell my students that my 2 sons have asthma, but if I bring them to the doctor for a fractured leg and they don't have to treat their asthma at all, then don't code their asthma. So again, even their guidelines said at I, chronic diseases treated on an ongoing basis may be coded and reported at many times as the patient receives treatment and care for the condition. long as they're receiving treatment or care for these chronic diseases during a visit for something else. If they're receiving treatment, code those chronic conditions as well. That was I. J, code all documented conditions that coexist. Straight to the guidelines. J, code all documented conditions that coexist at the time of the encounter or visit and that require or affect patient care, treatment, or management. Do not code conditions that were previously treated and no longer exist. However, history codes, which can be found between categories Z80 through Z87, may be used as secondary codes if the historical condition or family history has an impact on current care or influences treatment. So I felt like that was straight to the point. If they treated it, code it. K, patients receiving diagnostic services only. Refer to the guidelines. We're at K. For patients receiving diagnostic, now think about it, diagnostic services only during an encounter or visit, sequence first the diagnoses, the condition, the problem, or other reason for encounter or visit shown in the medical record to be chiefly responsible for the outpatient service provided during the encounter or visit. Codes for other diagnoses, such as those chronic conditions, may be sequenced as additional diagnoses. For encounters for routine laboratory or radiology testing, in the absence of any signs, symptoms, or associated diagnoses, then assign code Z01.89, encounter for other specified special examinations. And if routine testing is performed during the same encounter as a test to evaluate a sign, symptom, or diagnoses, it is appropriate to assign both the Z code and the code describing the reason for the non-routine test. For outpatient encounters, for diagnostic tests that have been interpreted by a physician, and the final report is available at the time of coding, code any confirmed or definitive diagnoses documented in the interpretation. Do not code related signs and symptoms as additional diagnoses, because remember, when the sign or symptom leads to a definitive diagnosis, then all we code is the definitive diagnoses and not the signs or symptoms. All right, let's see. That's K. Straight from the guidelines. L, patients receiving therapeutic services only. Now notice one is to determine. Diagnostic, you're trying to determine the diagnoses. Where therapeutic, you already know the diagnoses and you're treating it. So L is saying patients receiving therapeutic services only. So let's look at L. For patients receiving therapeutic services only during an encounter or visit, sequence first the diagnoses, the condition, the problem, or the reason for the encounter or visit shown in the medical record to be chiefly responsible for the outpatient service provided during the encounter or visit. Codes for other diagnoses, such as those chronic conditions, may be sequenced as additional diagnoses. The only exception to this rule is that when the primary reason for the admission or encounter is chemotherapy or radiation therapy, then the appropriate Z code for the service, chemotherapy or radiation, is listed first, and the diagnoses or problem for which the service is being performed is listed second. Now that can be tricky, but again, when the patient has these malignancies, these cancers, or they're coming in for chemo or radiation, then the chemo or radiation is the reason for the visit, so that Z code for chemo or radiation becomes your first listed diagnoses, and then use an additional diagnosis for the reason or the problem that the chemo or radiation is treating. Okay, we're down to M. Next video, M, patients receiving preoperative evaluations only. Guys, we're almost at the end. We only have M, ambulatory surgery, routine outpatient prenatal visits already captured up in the prenatal. So we only have M, N, and P, encounters for general medical examination with abnormal findings. And that's it. I am going to discuss Appendix A for present on admission reporting guidelines. We do that on an inpatient basis. So I'll briefly hit on what present on admission is. But we'll be back on our next video at M, patient receiving pre-op evaluations only. All right, guys, that is it. We are almost finished with these guidelines, and I've been asked, will I do the same for CPT? And it's interesting. We'll see what we're going to do there. I think I am going to do CPT next because I'm kind of enjoying these ICD-10. Thanks for all the comments. Thanks for all of the feedback that I'm receiving. You guys are showing me that you appreciate these guidelines. All right, guys, I'll see you in the next one.